Hi, good morning. On this National DNA Day, I would like to share some information on genetics and hearing loss. We all know that genetics play an important role and it can affect hearing as well. So, there are different genetic causes for hearing loss. You have syndromic hearing loss, which accounts for almost 30% of the genetic causes of hearing loss. For example, you have Usher syndrome, you have Waardenburg syndrome, you have Pendard syndrome. So, Usher's, you have hearing loss plus vision issues. In Waardenburg, you have hearing loss along with skin issues, eye issues, hair color. In Pendard, you have thyroid issues and hearing loss. The other group is non syndromic hearing loss, which accounts for almost 70% of the genetic causes. And here you have mutations of gene. So you have GJB2 that is responsible for connexin 26 protein. So these are syndromic and non syndromic causes of genetic hearing loss. If we talk about the inheritance pattern, then the inheritance you have four different types. Autosomal recessive, where both the parents are the carrier. You have autosomal dominant, where uh, one parent is having dominant gene. One of the parent can at least have dominant gene. You have X-linked, where it affects typically males. You have mitochondrial inheritance pattern, so it is passed through mothers. Now, talking about newborn hearing screening and genetic testing. So, in most of the developed countries, newborn hearing screening is mandatory. So, once the newborn hearing screening is done, after that, if there is refer or failure, then they do advise for genetic testing. So, talking about research and future directions, researchers all across the globe they are trying to explore different options in gene therapy, stem cell therapy, and CRISPR, which can be potential future treatment options available for genetic hearing loss. So, with this talk, I hope that it was somewhat useful, and in future we do expect better treatment for the genetic hearing loss. Thank you. Good day.
Hello, all the speech pathologists and audiologists of India. Happy National DNA Day. It is celebrated on 25th of April every year. As a speech pathologist and audiologist, we have dealt with a lot of patients who are affected by genetic disorders. So, could be one of the reason could be consanguineous marriage or the diseases running in the family. There are aspects that SLPs and audiologists can focus on. It could be prevention, specifically counseling or providing right information about the consanguineous marriages that are still prevalent, and also to uplift the inevitably getting affected population because of the genetic disorders, or even getting them help with genetic counselors or people who work on genomics, who can uh, impact these lives, who can prevent from passing on the diseases or conditions that might affect speech, language, hearing, swallowing, or balance, any of these functions which we deal every day. So I hope we raise the awareness, advocate for inclusion of the genetic testing and other aspects which require in-depth understanding, and also look at impacting in their life with better quality of service, thereby quality of life. Thank you very much, and I hope to contribute my bit in this aspect as well. Thank you.
Genetic hearing loss accounts for 50% of all cases of hearing loss. Genetic hearing loss can be 30% syndromic and 70% non-syndromic. So let's focus and reminder on XY chromosome in the clinical practice when needed. Thank you.
Good morning, everyone. The topic of discussion is heredity. It's alone or in contribution with environmental factor is most prominent cause for hearing impairment. It can be with family history or without family history. Over 400 genetic syndrome causes hearing loss.
Hello everyone, I am Dr. Seema Thakur, working as a genetic and fetal diagnosis expert at Fortis Hospital, Shalimar Bagh, New Delhi, and I have my own clinic in Dwarka. So today I would like to discuss about the deafness and its problem and its prevention. Deafness is one of the commonest causes of the disability, accounting for 20% of the cases of the disability. And as per the WHO data, about 7% of the Indian population is deaf, and out of which one third are children only. So, as you know, deafness can cause a significant physical handicap in the children and hampering their personal as well as the professional growth. And for the adults also, this is a significant handicap, this leading to the cut off from the world. So it's high time that we let's know how we can prevent and how we can treat this condition so that to make them as a effective members of the society. So the national program for the prevention and control of the deafness was launched in 2008 with an aim to empower the people with deafness and also to prevent the deafness, the preventable deafness by 2030. And there are various aspects of prevention. One is the primary prevention, which means we prevent the factors which can cause the congenital deafness, and the most important of that is the infection by the rubella and the cytomegalovirus in the pregnancy. So the rubella is preventable through the vaccination. So I would urge that whoever is planning the pregnancy should take before pregnancy rubella vaccination. The another common cause is the cytomegalovirus infection. There is no effective vaccine available for this, but still this is preventable by practicing the COVID like hand hygiene practices when you are handling, particularly when you are handling the kids' stool or the urine. Then the another way of preventing is through the genetic testing, the carrier testing, and this will identify the prospective carrier couples, and when both couple are carrier for a particular gene causing deafness, the prenatal diagnosis can be done at about 12 weeks of the pregnancy. Then we come to the early diagnosis and treatment, and here comes the important role of the audiologist, pathologist and speech specialists who help us in diagnosing the various types of the deafness by doing various audiometry tests as per the requirement of the patients, and they are also effective in conducting a very effective speech therapist. So they are a very important part of the prevention and the management of the deafness in the society, and the collaboration with the genetics and the speech specialist and audiologist pathologist is very essential to reduce the burden of deafness in the society, because these audiologist pathologists can help these families, those who come into contact, and they can direct them to us for the genetic consultation and genetic testing, and thus the the prevention in the next child of the people who have a first child with the deafness. So I suggest all of you to help in the prevention of the deafness through the vaccination, through the COVID related hygiene practices, and if your first child has got deafness, then the genetic testing can help in the next pregnancy. Thank you.